That's okay. Perfect. Okay. We're missing Amy. Okay. Is she the one sitting here? Okay. Sure. So.
Can you hear me?
Hi, yeah, I can hear you, Dave. How are you?
Hi, Dave. We can hear
Hi,
you
can you
here
hear me?
too. Yeah, we can hear you
Melissa?
here. Yeah, we can hear you.
Can you hear us, Dave? I think that's the question.
He's muted.
Hi, Max. Hi, Amy. Hi, Mei Ling.
Hi there. I'll keep myself muted most of the time. I have dogs.
Okay.
So they can interrupt.
So we're going to go ahead and call this meeting to order. It's a couple minutes after 3. We do have a quorum of commissioners here, and we like to do a couple of introductions. So I'm going to go up who I can see. Okay, perfect. So I'm Elisa Santos, a commissioner on the Pikes Peak Area Commission on Aging. I'm going to go right down the page. I see one of our commissioners, Debbie Swanson, is here. Connie Johnson is another commissioner. Amy Mitchell is here representing Park County. Dave Betzler is here. We have Colette Fisk. Melissa, will you jump in and introduce these people as we do this?
So welcome, Colette. Colette is our new ombudsman here at our agency.
Oh, good.
Thank you. We have a potential commissioner, Debbie Stanovich, that is sitting in to kind of hear what we do. She's deciding, I think, between this and the rack. We also have Kelly Hare. Am I saying that right?
Yes, that's correct.
And Kelly, who are you here representing?
I'm actually, I am representing, I'm a student with Metropolitan University of Denver. I work for the Alzheimer's Association as well here in Colorado Springs. And I am an intern with New Century Hospice. So, but I'm attending a meeting for a school assignment, and I'm completing my undergrad. And thank you for letting me be here.
Thanks for being here. Next, we have, okay. We have Max. I'm not sure what your last name is, but I know that you're going to present to us. So please introduce yourself.
Hi, I'm Max Kronstedt. I work for the Colorado Trust as an organizer in Fountain. And I am expecting Mary Kemp to be here as well, but I'm not seeing her. So I'm going to try and see if I can contact her quickly.
Perfect. Jody Barker is here with us today. Jody, if you can introduce yourself to our guests.
Sure. Good afternoon, everyone. My name is Jody Barker, and I am the director of the Pikes Peak Area Agency on Aging. So welcome to all of our commissioners and to our guests and speakers today.
I'm not sure who I'm missing. Claire Anderson is here, and Mei Ling Rodriguez, representing our seat on Innovations in Aging on the commission. Hello to both of you. Jen Nimmo is here. Jen, can you tell us who you're representing?
Hi, I'm representing the RAC. I'm also with Colorado Community Health Alliance, the Medicaid for Region 7.
Thank you for being here.
Mhm.
Marky Garcia Miller is here. Marky, can you introduce yourself? I mean, I introduced you, but where are you from?
Thank you. I am from the Pikes Peak Area Agency on Aging. I am a long-term care ombudsman.
Thank you also for being here. Jessica McMullen from the PPACG is also here with us. She's one of our liaisons to the commission. Jennifer Nihil is our military fellow here at the PPACG. Paula Levy is on now. I see she's another one of our commissioners. She is representing Teller County. Let me see, who else do we have?
So
Jenny Danner is here representing Park County for the Senior Coalition. Jenny, thanks for coming. Pam Zubek is from the PPACG? No.
No, I'm with the Independent. I'm a reporter.
Oh, hi, Pam.
Hello.
We have
Bee
we have Bee Babbitt, I believe, out of Park County. She's from the RAC. Is that correct? Oh, she's from
No.
Colorado Springs. Hi, Bee.
Hi, I'm the current chair of the RAC and represent Northern El Paso County.
Nice to have you here. Joanne Russell. Okay. We have guests Joanne and John, and we have John Lichten.
Hi, everyone. Yes. Hi, my name's John. I'm sorry. Let me mute. Let me mute the other one. Oh, my goodness. Oops, sorry about that. It's
Hi,
been a year
John.
and a half of pandemic. I still haven't figured out Zoom. I'm very sorry. So I've been asked to be here as a guest tonight, and my sister and I will be, well, I'll be presenting, but my sister's here for spiritual and emotional sibling support. So thank you for having us.
Great. Thank you for being here. So now that we're done with the introductions, we are going to do our agenda. So do I have to do? What's next? We have a quorum, and I wanted to add Max and Mary to the agenda. They weren't on the original agenda, and they're gonna speak to us.
I
And
make a
Elisa-
motion to amend the agenda.
That's Connie Johnson.
I'll
Yes.
second.
Who's that? That's Debbie Swanson.
Okay, perfect.
And can we get a motion to accept the minutes as they were presented for last month?
I move.
So
I
moved.
move. So moved.
Connie and Debbie again, was that you two?
Yes.
Thank you. We are going to move on to public comments. I'm not sure who wants to start this out. We have somebody from the PPACG. Do you want to start us out and tell us what we're looking forward to?
Hi, my name is Jennifer Horn, and I am I work with Kent Matthews in the Family Caregiver Support Center. And I was presented with a particular case where John Lichtenberger and Joanne Russell's mother's home was sold from under her. And I will let them kind of go through what they would like to share.
Great. Hello, Jennifer. Thank you so much. I was going to share a picture of my mom so you could have a picture of her and see her, but I know we have different meeting requirements. But my name's John.
You can go ahead and share your screen.
Oh, thank you so much. Just give me 2 seconds. I just want to share it. Hopefully you can see my mama there at
We
Christmas
can with a
time.
sweet picture.
Yeah, with me and my sister, and that's Joanne, who's also on the meeting today. So I think I've been asked by Jennifer and Melissa, who have been real guardian angels and really have helped us in a moment of crisis. I think they've asked us to share just a very brief story about my mom and what's happened to her in the last basically year and a half. So my mom is a wife of a military veteran. She raised us in a military family. Met my father in Korea, had about a high school education, and her English has always been a little bit limited. But she immigrated here, became a citizen, raised us as a military family, moving around quite a bit, and raised us while my dad went to the Gulf War, and has really done her best. But during all this time, she has had significant struggles with mental illness, which got worse as we got older. She has a lot of paranoia and a lot of delusions that we've tried to cope with, and she's been very functional until the last maybe 3 or 4 years, just kind of on a slow decline in her just general ability to interact with society. And certainly that has been exacerbated in the last 2 years because of the pandemic. And in that time, about 10 years ago, she bought a house in Colorado Springs. She bought it outright with money that she earned working, cutting hair her whole life. She worked to save this money to buy this house, this townhouse in the Ravencrest condominiums. And in the last 10 years, she has made all of her HOA payments. She's been current and able to function and pay all of her bills. But about, I would say about a year and a half ago, the condominium association changed the rules where they would no longer accept money orders as a form of payment. Now, mom has only ever used money orders. She doesn't believe in banking, partly because she's worried about, partly because of her mental health issues. She has trouble with banking. So but over 8 years, they allowed that. They changed the rules where they no longer accepted her money orders. And then they started sending her notifications of failure to pay her HOA fees. Mom is legally blind because she has cataracts. In the next year and a half, what basically happened was they pressed forward with legal action without my mom's knowledge. I don't think she was ever legally served. She's blind and has no support in the area because we are in different areas. I'm in Washington, D.C. And they basically put her house into a sheriff's sale. It was sold to a real estate developer. And I think then they aggressively evicted her. And my sister went to visit my mom in June, found out this was happening, contacted the lawyers or whatever was on the paperwork, contacted them saying that we would work with them to try to prevent this eviction, but they aggressively moved forward to eviction. She was then, the HOA then towed her car in the last week or so, and then forcefully evicted her against her will. Mom doesn't understand what's going on. She doesn't use the internet. She doesn't have a cell phone. She cannot read because she cannot see because her cataracts, which have significantly limited her vision in the last year and a half. I went to see her over Labor Day and tried to help her with these things. And in that time, my sister, my amazing sister, contacted the Pikes Peak Area Agency on Aging with Melissa and Jennifer, who have really helped us. I tried to contact Adult Protective Services, and we tried to use all the resources we could to either prevent the eviction or to reverse the sale of her house, which we feel like was illegal, and just try to help her. And we have not been able to do that. She was forcefully evicted, and then with the help of Melissa and Jennifer, we just were able to, as smooth as possible, transfer her to the care that she needs, that she's getting right now, and then hopefully we'll move forward with other placement. I just want to reemphasize that she owned her house. She did. She did everything she could. With her limitations, she did everything she could, and just to have her house taken from her and to have her evicted it's just been a lot. It's been very traumatic for all of us, and I'm sorry, it's been a long day. Very traumatic for all of us, and so I think we've been brought maybe today to talk with you about our experience. So hopefully I've summarized it for you. I can give you more details. I'm sure I'm leaving important things out, but we just don't think we just don't want to see this happen to people who, just with a little bit of help, I think we could have prevented this. We could have prevented her being dragged from her house that she owns. We could have prevented her from being cut off from everything she owns and any coping mechanism that she had. In the end, I think we're moving toward a better place for her and a better life for her. But it didn't have to be this way. And I think we maybe as a society could have done better. And I just, as a closing thought, I just want to say thank you so much to Melissa and Jennifer, and for all of you really for the work that you do in this space. You've made a huge difference in Joanne's life and in my life and in my mom's life. So thank you.
So John, thank you so much for presenting. I can totally feel how desperate the situation was. There's a lot of experience here on the commission as far as seeing these. I can say that what we're hearing here is not an isolated incident to any of us. And thank you for being brave enough to bring it to us and share it to us. We will take everything that you said and see how we can advocate better for seniors that may find themselves in this situation in the future, and see what we can do with all the experience of the commissioners that we have on board. And thank you for being vulnerable enough to share that with all of us.
Joanne asked me to do it because she didn't think she could make it through without crying. Well, this is what you're left with. You're left with me. I didn't do any better, Joanne.
Well, it's very difficult, John, when our parents work so hard to earn stuff and then really honestly kind of fall through the cracks because of language barriers, because of mental illness. I'm not sure if you're aware, I'm sure your team here that helped you, Melissa and Jennifer, told you that we have a Pikes Peak Elder Justice Center that is getting ready to open. And these are definitely issues that we are going to try and tackle with them because they're going to have all those great representatives that are going to do these specific kind of things. And
Thank
again,
you so much. Yeah.
Thank you for sharing. I know it wasn't easy, but thank you for bringing it to our attention.
I thought it would be easier, but it didn't go so well. But thank you anyway for your time. I appreciate it.
No, absolutely. And I believe we have another. So we have another family that wants to talk to us about some issues. Max and Mary, if you're on, please, you have the floor.
So I think Mary's still working on the Zoom link. I just had resent it to her. So I don't know if there's something else you all want to do first, or if you want me to start.
We can certainly wait for Mary and just continue on with our meeting, and we will be notified. Melissa will let me know when Mary gets on. Max, if you just want to hold tight and then jump back in.
Yeah, that would be awesome. Thank you.
Okay, that's great. So going down our agenda, we had, we were going to vote and we were going to do, this is our letter. Okay. Melissa's working on getting it up, but we had discussed in the past as commissioners that we were going to lend our support in a writing form to Silver Key because they were they're trying to do the process for affordable housing, and I think we were very all in support of that. So Melissa and Claire worked on some of the wording for us to support Silver Key. And I think in our executive meeting, we had decided that when we do these letters of support, that it was going to be myself, the chair, and also did we decide it was Claire? We decided it was Claire that is going to be the advocacy lead. So we would sign any letters of support we put out into the community. So I'm going to read it out loud in case anyone can't see it. It says, to whom it may concern, the Pikes Peak Commission on Aging encourages and supports Silver Key's efforts to develop housing that is affordable for older adults in the Pikes Peak region and is located within proximity to the Silver Key services. The commissioner's mission is to enrich the lives of our diverse senior community, advocating for effective and beneficial policy and encouraging robust collaboration among service providers for seniors. We envision every senior supported, honored, valued, and engaged, made evident by their inclusion in our communities. The senior housing project Silver Key is working to bring to our region fits our work as a commission. Housing that is affordable for older fixed income adults is important to the Pikes Peak Commission on Aging because it provides the backbone for an age-friendly community. An age-friendly, livable community is open, welcoming, and accessible to people of all ages, abilities, and mobilities. Services and resources for older adults are of particular importance in a livable community. The ability to age in place and in community fosters ultimate health and quality of life. Affordable and accessible housing for older adults is a vital aspect of the livable community. We look forward to Silver Key's success in building housing that is affordable for older adults in our community. To all the commissioners on the line, comments, support?
Very good. This is Connie. I think it's great. I like that our mission and our values, our vision statement are in there. Very good.
And you can thank Melissa and Claire for bringing that together.
Thank you, ladies.
Other commissioners, Debbie?
Yeah, I was going to say I am all in support of it. I'm hoping that we keep in mind there are other projects that are going on out there. I know Grescia is also doing a senior housing project as well. By virtue of having this letter of support, I think this was so that Silver Key could participate in a grant program, and this will hopefully give them a better edge in being able to receive that grant. I'm
Correct.
all for it. But I just want to be mindful that there are other organizations out there trying to also increase housing and that we want to support them as well. Maybe not so much for a letter for a grant, but just make sure that we say that we're supporting them and not just strictly Silver Key as well.
No, this one was specifically because Silver Key asked for one, and
Right.
But I agree, Debbie, and I would love to have Grescio Housing on as a guest for us to
I
present to
can
us as well.
arrange that. I'm very close to Lee Patke and Will Solar Lee, who is there. I'd be happy to have him come on.
Great.
I'll have him contact you, Lisa, or do I have him talk to Melissa?
Either one of us is fine.
Okay.
To have them present, that would be great. Any other commissioner feedback?
This is Dave. Can you hear me?
Hi, Dave.
Hi. So I think it's a very good letter. The going forward, as we look at 2022, it's probably a good idea to look at housing in a little bit broader context and just say that could be one of the issues that we really focus on for this coming year, so that it's not just a letter of support, but it's also then that we would try to engage in various or be aware of those other organizations that are working in this area, but also invite or get an invite to participate in those discussions, because we really are focused on advocacy and policy. And I think that housing is one of those key areas. Thank you.
So,
excellent letter, though.
Thanks for the feedback, Dave. So at our executive committee meeting the other day, we did bring that up. Since we now have more representation in all the counties that we were wanting. Last year, we said once we got the commissioners on board, we wanted to identify and ascertain 3 or 4 top areas that overlap with all 3 counties that we could affect change. Because I think we all agreed we don't just want to come to the meeting once a month. We want to know what we're doing is going to be effective. And so that's what we wanted to hear from the other commissioners. What are those top going forward into the new year that we want to work on? I think housing was always one, and mental health and mental assessments, which kind of ties that story from that family that we just heard from. Because I know that both Connie and myself were in senior living, and we heard these stories more than once about how mental health had led to either other things that the commission has talked about, domestic violence with a spouse, because they don't recognize who they are, somehow being evicted because they can't care for themselves, and it's a mental health issue. So this is very high on our radar, and it has been, but I really need the commissioners to maybe think about what your top 3 are as we go into the new year, or discuss it here, so we can do exactly what Dave said, dig deeper into those issues specifically. And what piece of the housing are we going to advocate for, or where can we advocate, or mental health or transportation, whatever the case is. We need all of the commissioners' voices on this to see what's important for you. And please keep in mind that our counties look very differently. Like, we're advocating for El Paso. There's rural areas of El Paso, but there's also very metropolitan areas of El Paso. Teller County and Park County are going to be even more rural. So when we pick issues to advocate, we want to talk about something that can have change for all of the counties we advocate for. So again, feedback from our commissioners that are on the line.
May I recommend that we all give you feedback directly by email within this next month? I mean,
That sounds
seriously,
great.
set a time, set a date. Get it down, get it written, just our own thoughts and opinions. I mean, that's all they will be, but that's something to start with for us to start the discussion.
Right. And then I would love to put that on our agenda for December, because we will have everyone's thoughts, bring them with you. We will discuss them as commissioners, because I would really like to know, as we're going into January, where's our jumping off point? What's important to us? What do we feel like we can have an impact on?
This is Dave again. One other thought there would be that for the December meeting, it would be helpful to identify each of us as we come up with our thoughts and priorities, if you will, the 2 or 3 major priorities that we believe are most important. It would be important to think that through and say and figure out and bring it to December meeting. Okay, what are the components that are elements of that issue that we need to sort of identify, and then figure out how we're going to attack them. It means really that we're going to have to buy into individual pieces. For example, research and study obviously comes to mind with housing. You just mentioned rural and urban. Okay, those are great distinctions there, but then there might be some other aspects of that we would need to do some research on as we continue looking at that issue for the entire year. Same thing with behavioral health. So at least that's one aspect that I think we need to be conscious of as we come into the meeting in December.
And there's the other that we could talk about, like the house sharing for seniors.
Sure.
We could have different people, but like you said, we need to identify which areas we are targeting. And then we will, like, if housing is all across for all of us, then we will go about identifying guests to speak to us on the issues that we are wanting to get behind and know more about, if that makes sense to everybody. But I love that idea of bringing our concerns and all of these to the forefront for the December meeting. And then we'll be able to lay out a plan going forward for the brand new year, and just jumping in fresh with those ideas for January, just get going.
If feasible, depending on the calendar, and December is a busy month, but if the inputs from the individual commissioners are made available to the executive board, that would help you structure then the agenda for that meeting in December.
That would be great, Dave.
Laid out there for us, okay?
So our executive meeting is the second Monday of the month. So if everyone can think of your ideas while it's fresh in your brain and get it to myself, Melissa, we can share it with the rest of the executive committee.
Perfect.
And that's great. I love that idea. And then we can break down what we've seen and at the executive committee and get it on the agenda for December's meeting.
And it would be great if we could do some of that in person.
So just saying that would be December 13th. You would like our information by December 13th.
Correct.
Actually, when is your meeting on December 13th? Before then, right? You probably want it before December 13th so you can have it for your meeting.
For our executive meeting.
Correct.
Mhm.
Okay.
Is what? The second Monday of the month?
So that'd be the 13th. So if we got you by close of business on the 12th, you would have it in time for your meeting on the 13th.
That would be great. Max, do you know if Mary is on yet? Is Mary on yet? 'Cause
Yes.
we'll-
Yeah, I think so.
Welcome, Mary and Max, if you'd like to jump in and kind of tell us what you want us to hear. Oh,
Excuse
hold
me,
on,
just
just
a
1 minute.
moment, Elisa.
Sorry, Jody.
This is set, yeah, I'm sorry to interrupt here. This is sitting out here waiting for a vote. So procedurally, you need to ask for a motion and a second and go ahead and wrap this one up before you jump on to the next and invite your guests.
I move that we accept the
Amy Mitchell.
letter as prepared.
Second,
So we have Dave and Amy Mitchell. Thank you, Jody.
All in favor?
Aye.
I,
Aye.
All opposed?
You're
the
all
com-
set.
All the commissioners on are for and no opposed. Okay, Max and Mary.
Great. Well, thank you all so much for having us today. We just wanted to talk to you a little bit about some of the work that we're doing in the downtown Fountain area around expanding food access. And I can give some background, and Mary can jump in with some of the activities that she's been a part of and some more specific concerns that she has around food access for older adults. And then we'd love to hear any of your questions or suggestions that you have for us as we move forward with our effort. So I work for an organization called the Colorado Trust, and our goal is to work with communities to help residents push for the changes that they want to see in their communities. So I work in the downtown Fountain, sort of Old Town Fountain area. And the organizers before me over the past couple of years, and then this past winter and spring, since I started working for the organization, one of the things that we've heard over and over again is that food access is a major challenge. The downtown Fountain area is considered a food desert. The nearest grocery stores are in northern Fountain. There's a Safeway and a Walmart, but that's about 4 miles from the southern part of Fountain, and there's not a lot of public transit. So over the summer and the fall, we did a survey on food access just to learn a little bit more about where people were getting their food, how they were getting there, and what additional options they think that Fountain needs. And so what we heard overwhelmingly was people were driving up north, or if people didn't have cars, then often they were going to the dollar store or to Loaf and Jug, where things are more expensive and there are fewer healthy options. And so in September we hosted, and we also overwhelmingly heard that what was needed was another grocery store, full service grocery store in the downtown Fountain area, so people could have a place that they could walk to or bike to, or even just drive to that would be closer. I know you all have a particular focus on people with mobility concerns, and so that was something we were hearing as well. And so then in September, we held our first community meeting, which is where I met Mary. So Mary, do you want to jump in and tell a little bit about what happened at that meeting?
I can do that, Max, but I'm struggling trying to get my picture to show. I guess it doesn't matter if people can see me. Can you hear me?
We can hear you,
Yes.
Mary.
I went to the meeting because it was advertised in the newspaper down in the Fountain Valley. And I thought, well, this is something that I'm trying to get involved with anyway, perhaps from a different angle. But I went to the meeting and there were several of us there from people I've known in Fountain for many years, are also involved in engaging with Max on this. And we came up with several brainstormed ideas, some which probably weren't too valid, but several that were. We were pleased that Scott Turner, Scott, what's his last name? The
Trainer,
city
the
manager.
city manager.
The city manager from Fountain was in attendance, and he was certainly voicing approval and positive reactions. However, he's government, and sometimes you wonder if it's all lip service. And Dawn Herrick was there, and she wrote a long letter to the folks at Family Dollar suggesting a better access for nutritional foods. As it was, she didn't send the letter because they were in the middle of management change. So she's waiting until they get a little bit more settled. But I thought the meeting was good. And then Max told me there were about 20 people that were there for the meeting on Monday. I was not, because I am in Idaho, and obviously with some communication difficulties up here.
Yeah, so then on Monday, well, in October, we held a meeting for Spanish-speaking residents in Fountain, and then on Monday, we held a follow-up, and we're really sort of taking the action ideas that we brainstormed and turning them into specific plans, and we had about 20 or so residents there. And so we're sort of most focused on demonstrating community support to our city government in Fountain for a grocery store. And then looking at what the city can do in terms of finding vacant lots and providing incentives to potential grocers to make a store happen. So that's where we're at right now. And so I just, Mary suggested that we bring this to you all to get your thoughts. And Mary, I didn't know if you wanted to share a little bit about what you had mentioned to me about some of the age discrimination that you were seeing as well.
This is Dave. Just off the top of the head reaction, I think that the description here of the food desert and the issue of availability and affordability, I mean, we talked those two A's, if you will, within the housing area. It's the same thing with food. It's probably pretty common across the areas as well, probably maybe even exacerbated, if you will, in the more rural areas or Park and Teller County. I think it's one of the things here as we, the commissioners, begin to grapple with the breadth and the extent of possible issues that we should be aware of. I think awareness is an important piece, but then it's also a matter of, okay, how do we sort of allocate or address these issues in a reasonable and a sort of in a priority matter as well. I think this is one of a great example where, okay, this is an educational issue and it's an awareness that we have to gain and appreciate and begin to look for the aspects in our own particular areas of counties or municipalities that we live in, that we can be aware of that and provide more information. I guess the reaction I have is that, okay, this is one where we need to get smarter and we need to continue to monitor what's going on. We need to be aware of the things that are being worked in particular areas like downtown Fountain area, and to see then if there are similar things that may be occurring, if you will, out in the region, in the rural areas and other counties. But I think it's an important area that we, as a commission, we need to be aware that this is an issue. Thank you for presenting.
I know Max was going to give me an opportunity to speak about the sidebar on this. Is that okay to do that now?
Sure.
Oh, okay. I've been kind of doing a survey with the sales and offers at the Safeway store down in the Fountain area. I'm sure they're similar in the other areas. And it's an issue to me that it seems to be discriminated shopping, because many of the signs are misleading. Many of the sales are dependent on a smartphone, which a lot of older people, including myself, don't have. There are signs that advertise sales this week, but the same product is half the price next week that it was when it was on sale. The signs oftentimes tell people what they need to do, but the writing is so very small that without digging my glasses out of my purse, I can't read what they say. The signs that are available for the shoppers in the Safeway in Fountain are discriminatory for the elderly, the sight challenged, the mentally challenged, the math challenged. I've watched people go in and buy products where they're paying the full price when they could be paying a sale price, but they don't understand the sign. And I'm interested in this. I'm about ready to write a letter to the editor as soon as I've got some more firm facts on some of the sales that are going on that aren't really sales.
So off the top of my head, I have a couple of comments having listened to this. I understand the challenges of downtown Fountain. I myself and my children volunteered for 5 years at When God's Pantry food and clothing store was down there. So I understand that there's nothing down there. I wanted to know if Silver Key comes down that far as Meals on Wheels, and Karen Share, because I thought when I was down there, Karen Share used to also donate food to God's Pantry when I was down there. I don't know if it's still like that. That was many, many years ago. And Mary, your issue, I think, is great, that you bring this to our awareness. Where I think this issue might be better is at a more advocacy level would be the Colorado Center on Aging on their advocacy meeting. Because what you're seeing in your grocery store as an aging adult, people are seeing across the state of Colorado. So the Center on Aging, formerly known as the Colorado Senior Lobby, they take into account what issues the aging population is finding across the state. And what you're saying, I think, could be a universal issues. There's Safeways and grocery stores and small misleading print across the board in the state of Colorado. So what they do is you go to their advocacy meeting, which a couple of our commissioners sit on, but anyone from the public is able to sit on, and they're every Monday, and we can get you the information. And they want to hear from the public what they're seeing about what bills they could put forward for the state of Colorado that would help our aging population across the board. So those are my two comments about maybe Silver Key, Karen Share, and the other one. So if any of the other commissioners want to jump in and have some feedback as well, any ideas you're thinking about for them?
Could I make a follow-up comment on the Karen Share issue?
Sure.
Okay, my church in security had for years and years done a food bank. We had food there at the church, and we had a population of folks who did come to get food there. And then Karen Share changed some of their regulations and some of the requirements, and we didn't have enough people coming to get food in the bulk items that were offered. It would just sit on our shelves because we didn't have that many people. And there are other churches down in the valley that also have these little food banks for people. But with Karen Share offering their food in larger bulk than we can use, we finally did have to close our food bank at our church. And so that's one less source for nutritious food in the valley. And I'm not sure about anybody speaking to that on the Karen Share and how they changed some of their requirements.
This is Dave again. I don't want to monopolize, so please just mute me if I get carried away here. I think it's important for us as a commission, again, to be aware of these issues, but I think that we also have to bear in mind that the responsibility is really for a very broad area and a very, very extended number of issues, and very complex and interdependent, interconnected issues. So we have to keep their sort of at a certain level here, I think, in our approach to this. I think an idea that might be at a commission level that would perhaps address an issue or part of the issue would be, okay, going forward in 2022, we as a commission could convene some sort of a food retailer forum where we would bring in 2 or 3 of the, or invite anyway, 2 or 3 King Soopers, Safeway, so whatever the other food vendors might be, and see if we can have a community discussion on it and look at what's working, what's not working, and see if we can come up with consensus on things that should be prioritized and it could be worked collectively. From a commission, I think that's the type of thing that we need to be focused on. I'm not downplaying the significance of what's going on in the fountain, specifically in the downtown area, in the food desert. Very, very valid issues. It's a matter of the commission to try to figure out, okay, so what can we try to do at a sort of a broader level, an integrated level, or a synthesis to bring the issue to a broader discussion forum, and then see if there are some specific things that can be we can move ahead with. So that's the 2 cents I would offer up.
So Dave, thank you for that. We had, obviously no one would be privy to that, but in the executive committee, we had talked about that, and I had kind of said the same things. Like, there's a lot of issues surrounding the aging population. And when we are talking about volunteer commissioners that meet once a month and we break off into other committees, we're representing 3 very different counties. And so we're taking all the information that people are bringing to us and trying to ascertain the most that overlap with these 3 counties and our goal really is to advocate and affect change. And so that's why some of our commissioners sit on the advocacy committee that's out of Denver, because we want to bring some kind of change. We want to see movement. And so while I'm going to have to echo on what Dave said, while we want to hear every issue people bring to us, we are not a full-time entity. And so we really have to stay on broader issues, but we are happy to share any resources or connect you with Silver Key. Or if we all know a resource at Karen Share, we're happy to share all of our resources and all of our connections. It's just, that's what our next step is going to be, is ascertaining these issues, these larger issues that we really feel like, because we're going to have to piece down those issues too. Do we have other commissioners with some feedback? I see Leilani, just to introduce her, Leilani Bancroft is on the line. She is one of our commissioners representing the Cripple Creek area, kind of that area up between Teller and Park. If people are not familiar, she works at Cripple Creek Care Center. So any other commissioners have any?
Yes.
Hi, Amy.
I do.
Amy, Park County.
Just a thought. I mean, I'm always in try to solve the problem mode as a county commissioner. And it may be worthwhile for Max and Mary to meet with Karen Share and see if there's a way that all the churches could come together on delivery day and meet and divvy up the food at that time frame, and then take back those smaller quantities if there's any way. I don't know how they deliver it and such, but they are a resource. And if they were serving the community in the past, and because of the volume they were delivering to one location, it wasn't working, there might be a way to be able to do that while you're working the problem of the grocery store. But we have to think outside the box in Park County, because talk about a food desert. For most citizens, the nearest grocery store is 40 miles away. And there is no convenience store or anything. And so we have to pool resources like that to be able to make food available, and then store it in community areas to make it available in a closer proximity to our small pockets of our little towns to make it available. So that's just a thought. But we feel your pain.
That's an excellent idea. And again, we're all about building communities, building neighborhoods, building collective activities. And that's a great suggestion, Amy. Thank you.
Melissa would like to speak from the PPACG.
Yeah. So for those of you guys who are looking at the 4 screen for the PPACG, video spot, there are a few of us back here behind the computer. So this is Melissa with the Area Agency on Aging, and I just wanted to share 2 points. I think it's good talking about the hunger relief side of things, However, I think what Max and Mary really are bringing up is the idea that they want to bring a grocery store into Fountain. And so they want to have a resource that's a grocery store that people can actually buy food at, and not necessarily just tapping into emergency hunger relief right now. It's, looking at ways to encourage the leadership in Fountain around bringing a grocery store there. And after I say one more point, I'll turn it back over to Max and Mary if they want to comment on that a little bit more. And then the second point that I think is really important that both Dave and Elisa brought up is the reality of sharing this at the state level with the Colorado, the CCA, the Colorado Council on Aging,
Center on
Colorado
Aging.
Center on Aging, because this is a broad issue in terms of food insecurity across our state. We know that there are other communities that do not have access to food, whether it's, getting a grocery store in there or if it's hunger relief. Again, I think what Max and Mary are looking at in Fountain is literally bringing a grocery store there. And so just wanted to just remind people that there are two different pieces happening there. So, and if Max or Mary want to comment on that.
Can I speak real quick? Melissa, I was going to be saying the exact same thing, that this is not quite what they were hoping for in terms of a discussion. And when it comes to getting a grocery store into Fountain like that, that's kind of an economic development issue. What does the city of Fountain see as being what's going to attract a grocery store there? And I'm just kind of curious, is that how you've been approaching things in the past with other communities? Do you talk to the economic development councils? Do you talk to the city planners as to what it would take to incentivize bringing in grocery stores? Is that something you have done in the past? And is that something we can look at for Colorado Springs, and maybe using the greater chamber to advocate for getting something for Lower Fountain to get a grocery store to feel like it's economically feasible for them?
Yeah, well, I
agree.
think
It's probably all dollars as well.
Yes.
It's going to be motivated by money because, as Amy
Yes.
Mitchell in Park County was saying, they certainly could use another, if anybody's ever been up that way, or like Cripple Creek, or even Teller County could use another big chain up there. But I think that that's going to be all led by money.
Right.
And so I think for right now, what would
Does
be
anybody, do we have any kind of relationships with the chambers or the Economic Development Council? Do we have anything that would say we could at least present the issue and be creative about a solution? Are there incentives available? What would they really need economically to be feasible there? Can we meet them halfway? What is it going to take?
So I don't think Fountain is the only one experiencing that in
Right.
the counties we represent.
Right.
You
That's
know,
why I was asking Max if that's how he approaches it in other communities.
Well,
So I've
again,
only ever worked in Fountain, but I think you all hit the nail on the head in terms of, what we are focused on is really a grocery store. Karen Share does operate something called the Sunnyside Market in the downtown Fountain area. So that is a food bank that people can come and shop at twice a week, or it's open 2 days a week. And we have been in some conversation with people with the Fountain Valley Chamber of Commerce and Fountain Economic Development. And that is definitely a lens that we're taking. But if there are sort of more regional or even state focused organizations or people who have expertise in that sort of economic development, those would certainly be resources for us. So I appreciate that as a direction for.
I know that Walmart has their neighborhood markets in poorer areas or places that are food deserts. They somehow found a way to make a feasible market for them that's workable for them. I'm just curious to know what that plan might be. I don't know if we would be the experts on that, but there are some, it's working somehow in other areas, but not in others, so these areas, but not others. So I would like to see I wouldn't say government, but at least the economic drivers of each community having a role in this and being able to talk about this and how it's going to, you know, how can they have a social impact that actually will drive people to their community?
I think this, again, this is from, you know, trying to stay at a larger picture, larger perspective. I think the important thing would be that we as a commissioners need to get together face to face and brainstorm some of these things. Because, for example, on this particular issue, this could be one of many that over the coming year, we would say we've gathered the information, we've distilled it or could distill it into a position paper or an issue paper, and that can be presented to the PPACG, which is not only a county, but it's also municipalities across the 3 counties. So again, that's an opportunity for us to advise or encourage, raise awareness on behalf of a particular issue that we are sensitive to. But fundamentally, we can't do this for everything. It has to be sort of a considered discussion amongst the commissioners to figure out, okay, for next year, what are the 2 or 3 main things that would be a priority? And then what are the other ones that we'll monitor, if you will, and consider raising as issues or discussion points with PPACG. We report to them. That's who we're really trying to, you know, we're trying to do policy and impact.
Right.
PPACG is a real key on some of these issues that are very broad, cross-cutting, that affect so many different areas. So
Dave, I agree. And I think you're right. We need to be very careful and very focused. It's just that Max and Mary came to us with maybe getting some suggestions. I don't think we are going to be the experts. I really don't. I'm just, you know, offering that's the solution that I see is actually working with the communities and their EDCs and making sure that they have at least a knowledge of what's going on, and you know, you appeal to them on the social impact of what's going on. That's just one solution from the whole body here. Not saying that we're going to be the experts, not going to want to claim that.
Right. And down in Fountain, maybe if you could put all the resources that you know of, like the churches, if those, what days and what locations. I know that God's Pantry still operates down there somehow as a food bank, all of these little things, or to let and I wasn't sure if you could maybe contact the Mount Carmel Center for Excellence, because I know there's a military population down in Fountain, and I live near there, and I see them giving out food from Mount Carmel. They do some kind of food giveaway. So I would even say, is there a local, I think there's a local VFW or an Elks down there, like really tap into your community, because they're willing to help vets in need and those kind of families. Like these little organizations that can at least help people get by this winter.
This is Dave. I got to take a brief interruption here. My dog has bothered me twice, needs to go out. I'll be back in a few minutes.
But I would really suggest, Mei Ling wants to say something, but the advocacy meetings, I think, are where these issues that could change it across the state, because this is not an isolated instance, because they just recently passed a bill that incentivized people to come here as physician's assistants or nurse practitioners to go to rural areas specifically, and they would help pay off some of their tuition. So we're talking about the same thing. These same areas that need these doctors are probably the same areas that also need supermarkets. So I really believe that's the governing body that could really help facilitate change for you. Mei Ling, sorry about that. Go ahead.
No, I think that you teed up what I was going to say really great, because as you said, this is not an isolated incident, and how this applies to older adults is really important, because some of the research shows that food insecure older adults is a huge problem. 1 in 14 older adults are food insecure, and especially when it goes to rural areas, a lot of it has to do with accessing it. So you can't have a huge Walmart. So it's looking at unique ways of how that is approached. And so I think that there's a lot of literature out there. And I think that I really like Dave's idea of how we can maybe compile it, maybe have some grant opportunities for how we can maybe have a hub and looking at unique ways of how that applies to us, because I think it's a huge issue. And I think that it involves looking at it dynamically, because farmers often have excess stock too, right? So I do think that it's not necessarily a resource issue, it's a dispersion issue too, right? So I think that it's about looking at different ways of navigating the system too.
I totally agree. And Max, have you ever reached out as far as fresh produce and stuff to Venatucci Farm down there, as they're right in Fountain? Oh, they don't have food anymore? They don't.
Yeah, they're not growing produce anymore, but I have been in touch
Oh.
with them.
Oh,
They
okay.
do weddings and events and things like that now.
Oh, okay. And my other suggestion is maybe tap into other, like thinking a little bit, like Fountain Valley, the private school sits down there. Could you maybe contact them and see if they do service projects and if they'd like to brainstorm with you about this? They have a lot of clout down there, being that private school down there for a really long time, and might have really good community partners right in that area.
I think that's a good idea, one that we haven't explored yet. But I do think that we're talking apples and oranges here, and I guess that's a pun. But we're talking about a grocery store, not really food banks and charity distribution. We need a grocery store.
Right. And I think
And
that's something that you're going to have to do at a bigger level.
I was wondering if there's anyone in the state that you know of that has already gone through this process of bringing a grocery store to their area.
Again, I still think it might be the Colorado Center on Aging that would know that. Does anyone else have suggestions of how to go ahead, Melissa?
And so this is Melissa again, and I can follow up with Max and Mary as well. Some of you know, I actually owned a grocery store at one point in time. So I can definitely follow up with Max and Mary a little bit on the whole food issue and some other ideas, and I can do that offline.
Do we have any other comments from the commissioners?
I just think this is great input. It gets us all thinking, and you're right, we have to stay focused, but I just think this has really been great discussion and very stimulating. Good job, everybody.
I know I may be new, and I don't know the Colorado area all that well. And I've lived in a lot of different states, and I can't remember which state. I've lived in Wisconsin, in New Mexico, in the state of Washington, but there are some states that have had little towns that have had some success in the town itself running a nonprofit, not-for-profit grocery store, and not losing money on doing that. And I don't know where you would find that research and how a town would go about establishing that kind of facility. But there have been towns in the US that have done that because they've been food deserts. And again, it's not just for seniors, it's for everybody who lives in that town who needs a supermarket. And that's why those towns found that it was successful for them to do that. And I just don't know where I remember seeing that or reading that. I don't know where you would go to find that information. Maybe other area agencies across the country, maybe other small towns or counties, that kind of thing. But I don't know, Max, if you've ever talked with the town of Fountain about doing something like that, if they knew they weren't going to lose any money to run something like that.
Yeah, that's not an idea that had come up, but it's interesting. So I'll definitely look into it.
And
Yeah,
also,
I
do you have
maybe-
anybody that's a grant writer that could research grants to bring that funding into your, like anybody that's well versed in writing grants?
I mean, maybe if you look on the internet in some way about, a town that had some space and decided to use that space, which they didn't have to pay rent on, to bring that, to bring in an actual grocery store that they actually developed. I don't even know where you would look for that. But I know it has been successful in some places.
One of our previous commissioners, when we were back under the city, Aubrey Day and her partner opened Bread and Butter downtown. And I know that they did get some grant money. So she might be another resource to reach out to.
Yeah, it's
Yeah,
called
Aubrey
Bread
and
and Butter
Stacy-
Grocery Store.
They were actually some of the first people we talked to when we started this, and they've been quite helpful.
And one last, I was going to throw this out to our commissioners that are on innovations and aging. Is it something we want to discuss as you guys go forward with 2.0 in the new year about discussions about food insecurity and do some breakout groups and stuff that we can help facilitate?
Definitely. Yeah, I think that as we move into next year and start doing some of those kind of listening sessions or focus groups, we'll definitely want to focus on this. And so we'll connect with Max and see if there's some, other ways we can help as well.
Great. Well, we really appreciate you all, opening up this space for us to come talk about what we're working on and for all the suggestions. I've got my list here. So yeah, I really appreciate it.
And if any of the commissioners have any other ideas, we can email them to you, Max, about connections or anything any of us have collectively.
Okay, that'd be great. I'm just putting my email address in the chat right now.
Perfect. Thank you.
All right.
So now moving down the agenda, Connie, do you have anything for us on membership?
Unfortunately, I do not. There's a couple people that said they were interested, and I'm still waiting to get an application back. So I'll keep you posted.
Okay. Claire, anything new on policy and advocacy?
Not at the moment. Our group, I think, will meet again after the first of the year. And we'll have some more stuff for you all at that time.
And again, for any kind of advocacy, anyone of the public can sign on to the Colorado Center on Aging for their Commission on Advocacy. And I know that they're calling for suggestions from all over the state of Colorado where they're going to be headed in the new year for new laws and new ideas. So we can get that.
I'm sorry, I was going to say you shared their next meeting in the chat too, Elisa. Thanks for doing that.
Melissa did that. And
Melissa, thank you.
Okay, so the next thing is I would just like to say I want to apologize to Melissa because I didn't introduce anybody in the room that's sitting here with me. I totally forgot. So Melissa Mart is our liaison for everybody that is online from the PPACG and works with us closely. She's part of our executive team and really gets the ideas flowing from the two organizations. Jennifer Horn is here from the PPACG and Kent Matthews left. And if you've been in the senior industry at all, you know who Kent Matthews is, and he's here with their team as well. He stepped out, but again, I apologize because we have a lot of the PPACG with us here today. So as far as my chair report, myself and Connie, and I'm not sure if anybody else online, we attended virtually. The Colorado Center on Aging had a Colorado-wide town hall meeting on the 9th. And I know for sure Connie and I were on for the whole 2-hour meeting. It was an amazing representation of ideas from across the state. I forget, they had like 40 or 50 counties represented. There was over 101 participants. We broke down into groups, into surveys. It was rural, it was metropolitan. So it was really great. We had Jarrett Hughes talk to us from the governor's office on the senior policy advisor on aging. So that was really great. The new tagline from the governor's office is for the state of Colorado is lifelong Colorado, meaning you come here, you live here, and you have a long life here. And they want that to be for of all ages. Age-wise was on the call. As we all know, by 2030, the demographics of our state are going to completely flip. There's going to be more people over the age of 65 than babies being born in the state of Colorado. And this is not unique to our state. It's happening across the United States. So that is why all of these agencies are coming together to see how do we age wisely, comfortably in our own states, what resources are there. So I know that we had talked about our advocacy of our commissioners about the homesteading tax. So when Connie and I were on, they let us ask questions, and they kind of told us flat out that the homesteading tax, they've been working on this issue. And what we mean by that is that if you buy a property or your parents and you go to, say you move to downsize, that homesteading tax, your tax reduction does not follow you. And they kind of told me flat out that they don't think it's going to pass. It's not in the best. Connie, am I right? That's what they said about that. Like they thought that our time would be better spent on other advocacy issues in the new year.
They said it would cost them too much money to even pursue that.
It says it's the cost of the program to the state is a deterrent for the state budget to go forward with this issue. And the reason I'm bringing it up to our commissioners is because you on the advocacy commission are going to disguise, after we have these issues of what we're going to prioritize. And so that's why we specifically asked about that issue. One of their key issues going forward is going to be elder fraud issues and scamming the aging population. I'm trying to see what else I wanted to share with you. They've heard a lot across the state about barriers to mental health. So that is high on everybody's, as we know, with the Pike Peak Elder Justice System. That's big on our priority list. We talked about a lot of issues that were discussed. They feel like for aging population across the state of Colorado, there is not good follow-up care, meaning they leave the ER or they leave some acute situation and no one follows back up with them. They fall through the cracks. Access to information was a huge one we heard across the state, because even though people may have computer, that is not easy for them to navigate if they know it all. So how do we disperse information about these issues across the state, which would affect our counties as well? Like if you don't, how do we get this information to them? Do we mail it out versus how are these different ways that we're going to get this information to people? The flow of information. They talked about minority issues, language barriers, different communities. So it was a really successful meeting. I'm trying to think. They were talking about more memory screening for aging adults, mobile assessments, memory issue, which would kind of tie into our first family as well that had spoke. If these were more mobile, if anyone that's dealt with aging seniors, if there's any kind of mental decline, you could be scared to leave your house. So mobile assessments, I know we have, I think Peakview does mobile assessments, but we just don't have enough that actually go out and do mobile assessments. So that is covering the town hall that we participated in. A couple of other things. Next month, we're going to have Nimble Sciences present to us. they have, and I think Dave, that you, Melissa told me, know a little bit about this app, Nimble app. It's for fall preventions that could speak to your smartphone and interact. So I thought that would be a great resource for all 3 of our counties, even for grown children, that could help monitor mom and dad's falls in houses or even in communities, what have you. So they're going to present next month. So think of any questions that you want to bring to them. Also, before we have our meeting in December, CONO, the Council of Neighborhood of Governments Council, or CONO, is going to do their not reopening, I forget what they're calling it, which I plan on attending. It's my understanding that they want to expand it's the Council of Neighborhoods. They want to expand, and they are bringing on ambassadors for different neighborhoods across Colorado Springs, which, like, the ambassador would take all the issues of that neighborhood, whether it's keeping an eye on your aging neighbor, or are you theft or packages, and there would be an ambassador. So I have talked to the new executive director for CONO, is one of our old commissioners, Sarah Voss. So she's open to the idea of facilitating information to us of what they're hearing, and that will be probably come like a liaison report in the future. And the other thing on my list to discuss was our goals for the new year, but we've touched on that in several other segments. So I think we are done with that.
This is Dave. I've got to run. We've got a family event here. It's been a great discussion, great identification of issues and things to do. I really urge that commissioners get together face to face and we brainstorm. We've got homework on our own part to do. We can take on all those issues, but we've got to figure out, okay, how are we going to digest all this stuff and then prioritize it and figure out what we're going to emphasize. So ideas are really good. And I think it's a great idea to get this stuff to the executive directors or the executive director group before the 12th.
Dave, before you get off, since you're a commissioner, one of the things to discuss was we have some commissioners coming off in December. So we need nominations for the chair and the vice chair of the committee. I had expressed that I would stay on as chair if that's what the other commissioners deem. If not, we need to elect these positions.
I endorse your continued chairmanship or chairship.
Okay, I just wanted you to be a part of that discussion before you got off.
Yeah, I agree. And I'll be thinking about that and see if I can provide some information.
Okay, sounds good.
Thank you again. Great meeting.
And now I'm going to turn it over to Melissa to go over some of the board items from the PPACG.
And actually, since Jody's here, I'll let him make a few comments
Oh,
about
yeah, sorry,
that.
Jody.
And then ultimately, as we get to be a more well-oiled machine between the RAC and the PPACG board and all those kinds of things, hopefully there will be a person on the Commission on Aging who wants to actually share anything that they got from going to a PPACG board meeting. But for now, I will encourage Jody to share a little bit.
Yes, good afternoon, everyone. Really briefly, the PPACG board has been focused on end of year, the usual end of year type of things, budget and some state and national level focus projects. Greenhouse gas projects continue to be a challenge with our transportation department. That's the transportation department at the PPACG level, not our mobility side or senior ride side, but budgets are being finalized. Do know that we are in the midst of finalizing, and this is coming from our policy and communications manager, Jessica McMullen. She's finalizing annual report, as well as some prioritization documentation. So as soon as those are available for public release, we'll make sure copies get to all of you as well. We did have the back mid-October was the legislative roundtable. That's something that we host every year. I would really encourage members of the commission to participate in that. Typically, that is where we have both PPACG board members who, as you know, most of those are elected officials, but we also have state officials, as well as usually representation or representatives from our national lawmakers as well. And so it's a great opportunity to hear what's going on, what priorities are being worked on across the 3-county region, but also at the state and federal level. So that's typically mid-October. And I know this year, Claire Anderson was able to attend. And so thank you for being there, Claire. So you got to hear, of course, some of the conversation was around the Homestead Act concerns, and yeah, that is going to be a struggle. They have joined that with some language around disabled veterans to provide another part of our community across the state that could benefit from the Portability Act that Elisa alluded to. The portability is really the concern. Right now, the Homestead Act is fully functioning. It simply means that if you are over a certain age and you have owned your home for 10 years, you get a tax break. And the challenge as we look across our community at housing challenges, but also making sure that someone can age safely at home or in place, whatever that might mean for that individual. Sometimes that 3-bedroom, 4-bedroom, 5-bedroom place that they had and raised their family in is no longer the best place for us. And so if someone is realizing a challenge in their property taxes and could solve that by downsizing and freeing up the larger house for a younger family and downsize, but still hold on to that Homestead Act exemption, then there's a lot of positive to that. However, because of the way the state budget works, it's not budget friendly. And so there is a lot of discussion, a lot of commitment from our state level folks that they were committed to continuing to work on that. But because of how that was originally written into statute, it may actually come before the voters. And so be watching for that. It may not be just with our legislators. It may ultimately come before the citizenry for a rewrite of the statute. So be watching for that, be listening. It could certainly be extraordinarily beneficial for both our aging population as well as our disabled veteran population. Aside from that, the board of directors does have a planning meeting coming up. It's not open to the public. It's just a board planning retreat in December with focus on goals and going into the coming year. So as we have some of those other public reports get finalized, we will make sure the commissioners have those. So thank you very much for your time, and thank you for all you're doing to serve the seniors of our 3-county community. So thank you very much.
Thanks for bringing us up to date, Jody. Okay, we also wanted to discuss the letter of support for innovations on aging as they do 2.0 going into the new year.
Thank you, Elisa. I'm going to share my screen real fast with everyone, if that's okay.
Absolutely.
Perfect. So thank you for the time. I appreciate it. We just wanted to quickly talk about age-friendly, 2.0. When we presented about age-friendly at the PPACG board meeting back in September, one of the recommendations was that we put together just a brief sort of statement of support and ask the commissioners to support that letter. And this letter will go back to the PPACG board as well as to the administrators in El Paso County. And so I think our plan is that I will share this with you all today. This will be sent out to you all, and then you'll get a little bit of time to take a look at it, and we could vote on this at the next meeting, at the December meeting. So if everyone can't see this, I'll just read quickly through this just in case there's anyone who can't see it. In 2015, Innovations in Aging Collaborative committed to pursuing an age-friendly city designation through AARP and the World Health Organization. In March of 2016, Colorado Springs was designated an age-friendly city. IIAC went to work and convened community members, experts, and professionals to begin writing the plan. In November of 2016, the Age-Friendly Colorado Springs Report and Action Plan was released to the public. At the end of 2020, Innovations in Aging completed our first 5-year continuous improvement cycle for age-friendly Colorado Springs. IIAC showed an impressive 94.3 success rate with implementing the initiatives within the plan. In 2021, IIAC evaluated its social return on investment through a rigorous study with the National Institute for Social Impact, increased its capacity by bringing on a full-time program manager, completed the Better Aging Civic Index analysis with the National Civic League, focused on the 2016 age-friendly plan, engaged with El Paso County for discussions around a countywide initiative, and focused on strategic planning for the second 5-year cycle of age-friendly in our region. Commencing January 1, 2022, IIAC intends to begin a second 5-year continuous improvement cycle, broadening the age-friendly work into El Paso County. Because of the demonstrated work and success of Innovations in Aging Collaborative in the first 5 years of age-friendly Colorado Springs, we support the second 5-year cycle of age-friendly in our community and encourage Innovations in Aging Collaborative to explore age-friendly on a countywide level beginning in 2022. So,
sounds great, Claire.
I have a baby talking in the background here. I'm sorry if you can hear it. So Elisa, I think that my only request today, and I appreciate the time, is just for folks to think about this and take a look at it when it gets sent out. And then Mailing and I will step away when we vote on it at the December meeting.
I think we had kind of discussed this before, that we were all in favor of it, and thank you for getting the letter together so we can see it, and we will vote on it next month.
Great, thank you so much.
And again, we need a call for chair and vice chair. We're going to have to vote on that next month because we have commissioners going off. Our vice chair, Connie Johnson, is going off. And just to remind everybody, Claire was going off in December, but Claire and Mei Ling share the seat for Innovations in Aging, which we all voted in favor of to keep as a permanent commissioner. So Claire is not leaving us. So we will have Claire or Mei Ling. And what we decided at our executive committee was, if they are both at a meeting, Claire will be the voter. If Mei Ling is attending by herself, she will vote for Innovations in Aging for that commission seat. Melissa.
Hey, so I just want to kind of share a little bit of clarification around the discussion around the executive committee and committee chair appointments that Elise is talking about. So today is really just a matter of being aware that this is going to happen, and that by next month, that the commission should be prepared to vote in, who the chair and vice chair will be. And so, and then the chair will actually, kind of think through and be looking to those people who want to hold the committee chair appointments, so that hopefully she can appoint that at the meeting in December as well. So as we, kind of talk about this today, it's, we don't have to, make a vote today. It's really a discussion, and just kind of keeping in mind, if there are folks that are interested in being vice chair, to be sharing that with Elisa. If there are folks that want to be the chair, and are excited to do that and give Elisa a break, but she has definitely said she would be happy to continue. And then, who's interested in some of those committees that we have. So just want to make sure that we know that we don't have to vote on that today. It's just Elisa is taking names and getting people excited about it.
Yes, thank you for clarifying all of that. I don't think we have any more liaison appoints. Our next commission meeting is on December 15th. Hopefully still a hybrid. Everyone stay healthy. Our executive committee is on the second Monday at 11. And we're looking forward for all those topics that we want to kind of narrow down for our goal and focus for the new year. And like we said, once we get those, then we'll kind of dive deeper about what we think we can do to go forward with those issues. And the advocacy meetings, are you all still meeting on the 4th Wednesday, Claire, of the month?
We haven't been. Mei-Ling and I were just saying to ourselves that we need to check with Vanessa. We haven't heard much from Vanessa. So we'll circle back around and check on her and make sure everything's okay. And then I think we should try to get those Wednesday meetings back up and running again.
Yes. Okay. And for any of the commissioners that sit on that Monday meeting for the Colorado Center on Aging, I'm pretty sure Claire has gone to them, Vanessa, maybe Mei-Ling. I think Amy Mitchell has sat in on them, and Jenny Danner from Park County to know what's going on. So I think they're really helpful, because it also lets us know when you guys are hearing what the big push is around the state, because I think if we all have the same issues, that's what they're probably gonna, push harder for, if we're all experiencing these same issues. So I think it's great that our commissioners sit on that committee as well. Is there anything else anyone wants to discuss before we end our meeting? Any announcements, anything that any of you are involved in that we should know about?
This is Amy Mitchell. I'll give Jenny Danner a kudos. We are twice a month, the first and third Mondays, having brunch with seniors, currently at our community center in Fairplay. I think we had a very good turnout on Monday. I had a chance to sit down and talk to the folks that showed up to have a nice meal. Got a really good feedback that I will share in writing about what I think some of our needs are for 2022. And if Jenny would like to say anything else, but they really do enjoy getting together and having some camaraderie. They help give each other's rides to attend, and it was really great to see. So thanks.
That would be great if you would maybe share with us in an email the location and time, either you or Jenny. I think Mondays are something that I could make a trip up there and have brunch and maybe.
Absolutely. I would be happy to do that.
Perfect. Thank you. If no one has anything else, we will call this meeting we will adjourn this meeting. Everyone have a wonderful Thanksgiving with your families. If you're traveling, stay safe.
You too. Thank you so much. Nice job.
Bye, everyone.
Thank you.
Debbie, before you get off, if there's anything you want to